And Seattle was one of the urban Indian sites for the Relocation Act, and it worked to try to move natives from their reservations into urban areas. And when they got here, they didn't have the resources that they had been promised, things like education, jobs, and healthcare. And so from that came the civil rights era, and with that, the American Indian movement that was, my dad was a part of.
What we realized is that our fiduciary obligations didn't end just because we were now living in cities. And so we had community members who fought to ensure that fiduciary obligation followed us.
And they worked to meet the needs of the people who were here by getting health care and reclaiming the land that had been taken. And so out of the Fort Lawton takeover here in Seattle by Bernie Whitebear, who was a part of the creation of the Seattle Indian Health Board, as well as working with other women in the American Indian Service League, they developed this clinic, initially as a volunteer clinic to try to help the natives here who needed health care.
I think our clinic provides our patients a home. A lot of patients don't even live in the Seattle area, but they choose to drive here or take multiple buses to get here because this is where they feel comfortable.
Whether or not we're biologically related, we develop these really strong relationships in the community. And so we felt like it was really important to remember that we're always treating people not just as a patient, as the Western model teaches us, but as a relative.
It's been pretty incredible. Just full spectrum training in the setting of an incredible community that's appreciative of kind of everything going on here in a community or family style of treatment.
At the Seattle Indian Health Board, we saw this as an opportunity to provide services in the way that we always have, which is treating things, all things in parity. Right? So it's not just behavioral health, it's not just primary care, but it's also traditional Indian medicine.
Everyone has like a different area that they can contribute to the health of the patient, and realizing what our abilities are and what I can do to support someone else. It takes a village, like the saying.
It is also substance use disorder services, readily available, dental services. Our Indigenous Knowledge Informed Systems of Care is the very first of its kind, where you can access all of these disciplines as part of one team of providers.
We are trying to change the narrative of what it has meant to see healthcare in Indian country. And by that I mean we're using the most evidence-based medicine approaches, we're using the best technology.
It's been incredible. The training itself is a strong combination of both inpatient and outpatient clinic settings, and I think that it's definitely helped prepare me for feeling comfortable in a lot of different environments. And I think the health board especially has been great with teaching different types of procedures and help prepare me for rural medicine, because that's where I'll likely end up after graduation.
We're training family physicians to go anywhere, and they're going to be completely prepared to do family medicine at its best.
I feel like I have a lot of support from my preceptors, my site director. I know I can contact them anytime, any issue that I have. I know that if things come up, they're going to talk to me and let me know ahead of time so I can work through things. Residency's tough, but it's nice to have people that are there to realize that or been through it and can kind of guide you through it.
Part of my love for this job is being able to continue to invest in the next generation of doctors so that we know that the doctors who are going to go out and work in our tribal or urban centers or even our community health centers are going to be trained well.
Because it takes everything to be able to support our people. And that our relatives, our patients, our relatives are at the center of decision making around their health.
For us, and this notion of wanting to have a place that felt like home, like community, as Indigenous people, we all are part of a family. And so we felt like it was really important to remember that we're always treating people not just as a patient, as the Western model teaches us, but as a relative.
I think that's huge because we're able to develop connections, we're able to develop rapport, and I think people are able to trust a lot of us providers and staff and feel like this is a place that really cares about them.
I think that when we select team members to join us in that vision and guiding our mission and our commitment to our relatives, we're looking for the best. You know, we're just really looking for people who are passionate and who understand what it means to be a good relative.